Good afternoon, everyone. It's a great pleasure for me to be here today in this webinar about aging, which is a very hot topic. And I'd like to thank the organizing committee for the kind invitation to participate in this event. And today I'm going to talk about a very hot topic in my field of research, which is reproductive medicine. And I'm going to share with you the idea of using cryopreserved ovarian tissue as a natural hormone replacement therapy. So for the ones who are not in this field of research, first I'd like to give you a brief introduction about ovarian tissue cryopreservation and transplantation. So this strategy is quite new. It has a little bit more than 20 years. And at first it started as an approach to preserve fertility in cancer patients, basically in young girls, because we cannot stimulate the ovaries to collect the oocytes. So instead we collect the ovarian tissue. And also in women who need to start a cancer treatment as soon as they are diagnosed with the disease. So they don't have these 2 to 3 weeks to go through a protocol of ovarian stimulation to collect oocytes. Due to the very good results we obtain with this strategy for the cancer patient, we start to propose this technique also to patients with non-malignant pathologies with a high risk of premature ovarian insufficiency. So who are these patients? So they are women who need to go through bone marrow transplantation due to different types of anemia, patients with autoimmune diseases requiring chemotherapy, like patients diagnosed with lupus, patients with ovarian pathologies like endometriosis, ovarian torsion, patients with endocrine or genetic diseases like Turner syndrome, or women with a family history of premature ovarian failure. So it's a technique that has been highly increasing worldwide. And how we proceed with this technique. So when a woman or a girl is diagnosed with a cancer or one of the diseases that I mentioned before, she comes for a laparoscopic procedure to remove a piece of her ovarian tissue, which will be frozen immediately after the procedure. So once the patient wants to become pregnant, she'll come back to the hospital and then withdraw a fragment of ovarian tissue and transplant back to this patient. And what we have as a result. Before I talk about the result, I'd like to give you some numbers about the importance of this technique currently. So we start the first ovarian tissue cryobank in the late 90s. And as I told you, this is a very recent technique. The first live birth of following transplantation of cryopreserved ovarian tissue was in our hospital in 2004. And since this period, that was a huge interest in this technique worldwide, as you can see here in this map with all the different cryobanks in the world. And we have more than thousands of women and girls who have underwent ovarian tissue cryopreservation. We have around 700 patients who went to transplantation of cryopreserved ovarian tissue. So as you can see, there is a huge difference between the number of cryopreservation procedures and transplantation, because between transplantation and cryopreservation, the patient needs to recover from the cancer. Some of these patients will never become infertile, so they don't need this cryopreserved tissue. And some women, they wait to be transplanted when they really want to become mothers. So right now we have more than 200 live births worldwide following transplantation of frozen tissue. The pregnancy rate is quite high, it's 37%. Live birth rate is a little bit lower than 30%. And the duration of the graft lifespan is more than 4 years. So the patient has between 4 and sometimes some patients have the duration of graft more than 10 years. So she has this big window of opportunity to become pregnant. But if she doesn't get pregnant in this time, we can thaw some other fragments of ovarian tissue and transplant to the patient again. So usually what we do is we don't thaw all the tissue that we froze, but just a third of it. So we give at least 2 other opportunities for the patient to become pregnant and have kids. So the duration of the graft lifespan can be increased through several transplantation procedures. So, and this is what I want you to keep in mind because of the goal of this presentation is the restoration of ovarian function. So we have here around 27% of live birth rate after transplantation of cryopreserved ovarian tissue, but the restoration of ovarian function is almost 100%. So it means that almost all patients that were transplanted recover the ovarian function and produce hormones, as we can see here. So a few months after transplantation, the patients start to have cycles and the levels of estrogens increase and the levels of FSH decrease to the results similar to what we had during reproductive age. So based on these results in cancer patients and patients with benign conditions, we can ask ourselves, could we consider ovarian tissue cryopreservation and transplantation as a natural hormone replacement therapy? So the idea here behind this possibility is to see that one century ago, we would live around 50 years, sorry. So most women would die before experience menopause or in the first years of menopause. Now, most countries in Europe and Asia, we have life expectancy around 80 years old. So it means that for us women, we live 1/3 of our lives in menopause. So, and this has a huge impact on the quality of life of millions of women. The period of perimenopausal, can be very harsh for some of us. We can experience a huge range of symptoms that dramatically affect the quality of life of these women. And at long term, there are several side effects, several consequences of menopause in the quality of life of we women, like a high risk of cardiovascular disease, osteoporosis, depression, etc. So it really affects the life of women, her relationships, her work, and not only that, but it affects society in general. So I just found this article that was published a couple of weeks ago in The Guardian, saying that more than 1 million women in UK could quit their jobs through the lack of menopause support by the work. So this is a huge consequence for the woman herself, who has to take a quite drastic decision. Probably has an impact on the finance of the family as well, and has also an effect in the economy. So there are more and more papers out there showing the effect of menopause for the patient, not only the health, but the cost of menopause for the patient. Like a study a few years ago mentioned that a higher follow-up healthcare costs per year in patients experienced symptoms of menopause compared to women without symptoms of menopause. Of course, this is a burden. There is a burden of also for the healthcare system. In US was calculated that the cost of treating broken bones related to osteoporosis in 2006 was around $18 billion. In Australia, the government spent around 300 million Australian dollars in drugs to treat postmenopausal osteoporosis between 2014 and 2015. In Canada, the cost of osteoporosis increased dramatically in the last decades. And of course, for the global economy also has a huge impact. So a study showed that women experience vasomotor symptoms, which are just the hot flushes and the night sweats, lose around 60% more work productivity in days, which we can translate to around $2,100 per woman per year. And this means that the productive loss for these symptoms alone, for these two symptoms alone, is around $150 billion per year. So as you can see that, and this will just increase because we're getting older and older, and the number of our older women population is dramatically increasing. So what we could offer for these women, so the idea here is that the patient, when she's between 20 and 35 years old, a healthy woman, should have a laparoscopy to collect a piece of her ovarian tissue, which will be frozen just like we do for cancer patients. And once you start experiencing the first symptoms of menopause, she would come to us to have the transplantation of pieces of her ovarian tissue. These pieces, as I mentioned before, would have a lifespan between 4 and up to 10 years. And once she starts experiencing the symptoms again, she'll come back and we'll transplant more tissue to her to increase this duration of ovarian function. The basic advantages of having the OT-based hormone replacement therapy compared to pharmacological hormone replacement therapy is that this is a real physiological, it will give a real physiological serum levels of hormones because it's a piece of ovarian tissue. When you have drugs for hormone replacement therapy, you have constant high levels of hormones, which is not what we have physiologically, because this is not a delivery that's controlled by the hypothalamo-pituitary-gonadal axis like we have with a normal tissue. The other advantage of transplanting tissue compared to drugs is that we not only have estrogen and progesterone, but we have also the synthesis of other important molecules for us, like different growth factors, and also some peptide hormones like inhibin and activin. So the question that you can pose now is, you can say, well, this works very well for patients who want to become pregnant and have babies, but would that work for healthy women who want just to have a restoration of ovarian function? So indeed, there are some preliminary data in humans who transplanted the ovarian tissue just for restore ovarian function in this patient. So there's one of the studies was in a patient in the United States who had heterotopic autotransplantation of her cryopreserved ovarian tissue just to restore ovarian function. And the study reported that the levels of hormones increased after 14 days following ovarian tissue grafting. And there are two studies here in Europe who used ovarian tissue grafting to induce puberty in two girls who had cancer. And the results were also very, very promising and showed that after 4 months of grafting, these patients start to have the function of ovarian tissue and start to have the symptoms of puberty. So what is also very interesting here is that although the idea of using ovarian tissue as a natural hormone replacement is quite young, there are several studies already in animal models who show that this has a very, very good result for the quality of life of these animals. So there is a group in the United States who has been actively studying this for more than 20 years in mouse, showing that when they remove an ovary from a young animal and transplant it to an old animal, there are several good consequences for these animals. So they show that when an old mouse receives a young ovarian tissue, should increase the life expectancy by 40%. It has a drastic improvement of cognitive behavior and sensory function. She also, the animal also experienced restoration of immune and renal function. There's preservation of bone mineral density, a positive influence on skeletal muscle mass, restoration of cardioprotective benefits, and reduction of inflammation in these animals. And not only that, but there's also some studies in rats and in rabbits who show that grafting a piece of young ovarian tissue in an old animal can prevent bone loss, can restore bone parameters, and improve bone healing. The other question that you can ask is that, but if I remove a piece of my ovary, would this increase the possibility that I have my menopause earlier than I would normally have with both intact ovaries? Well, there are no studies about this, but there are some studies on the effect of unilateral ovarectomy in women, not for cryopreservation of ovarian tissue, but for other problems like ovarian torsion. So removing one whole ovary can decrease, can have an effect on the age of menopause by 1 to 1.8 years earlier than a woman with 2 ovaries. So there's not a huge difference, there's not a significant difference if you remove one entire ovary, which is not what we can propose for healthy women who wants to use cryopreserved ovarian tissue as a natural hormone replacement therapy. So in summary, I would like you to keep in mind and think about ovarian tissue cryopreservation and transplantation is that it's a procedure that has been increasing worldwide. It has given very robust results in terms of live birth rate. And for us, what is very important is for the restoration of ovarian function, which I mentioned is almost 100%. The duration of graft activity is more than 4 years. We have patients that have the duration around 11 years. But we can also increase this duration by grafting the patient many times. This possibility could potentially, in my opinion, be applied as a natural hormone replacement therapy instead of pharmacological options that we have currently. But of course, you need to keep in mind that studies are necessary to confirm the preliminary data that we have in cancer patients and patients with benign conditions. And of course, compare the benefits that were observed in animal models to see if we could observe the same thing in women. Thank you very much for your attention.